So in this video, I'm going to discuss about one of the famous medication known as Digoxin. So during your NCLEX exam, there are highly chances that you're going to see this medication and they're gonna ask you a lot of question on Digoxin, right? So I will try to explain you in simple words how does this medication work. So once you know the content, then at the end we will do around 15-20 practice question and you will see how easy it is for you to solve all of your question immediately, right? So let me tell you how does it work. So digoxin is, so how it's gonna work. So let's say this medication is given to the patient with a heart failure and AFib, right? So what happen in heart failure? So the heart, right? So heart is trying to push out all the blood to your body, right? Like normally it does like this, right? So but because of too much blood around it, your heart is gonna pump like this. Instead of going like this, it's gonna go slow like this. So when somebody get digoxin, right? So when somebody get digoxin, what happen? It increase the contractility of the heart. It will increase the contractility of the heart. So instead of going slowly, it's gonna go like this. And once it does like that, it will increase the contractility. See how it's working now? Instead of like this, it's going like this. So it's increasing the cardiac output, right? So it's pushing out all the blood to your body, so all the good nutrition like oxygenated blood reaching to your body. So that's how it's gonna start working, right? So that's the first thing you need to know, like this. That's the function of this medication: increase contractility of the heart and increase cardiac output. But however, same time what it does, it also will decrease your heart rate. It will also decrease your heart rate, right? So that is very important. So when you are giving this medication, you must know that this medication drop the heart rate. That's the function of this medication, right? So now so hope you get it right. So now during your exam, they're gonna give you which family this medication belongs to. So first thing first, we're gonna go every single point. So we're gonna go every single point which will help you to understand every single main point, right? So this family belong to cardiac glycosides. If they ask you which family this medication belongs to, beta blocker or like this or that, then you're gonna choose cardiac glycoside. That would be your answer, right? And second thing, when you should not give this medication. So that there are three categories when you should not give this medication to patient. So adult, if the heart rate is less than 60, you are going to hold this medication, right? In adult, hold this medication if heart rate is less than 60. Very importantly, during your NCLEX exam, they're gonna ask you, right? Second thing, child. If the child heart rate is less than 70, then you are going to hold this medication. And thirdly, infant. If their infant heartbeat is less than 90 or 100, then you are going to hold this medication. So see, three categories: adult less than 60, child less than 70, and infant less than 90 or 100. Then you are going to hold this medication, right? Next thing, what is the normal range for this medication? So 0.5 to 2.0 nanogram per milliliter is your normal range for digoxin medication, right? So another thing that you need to know is early symptom of digoxin toxicity. So during your exam, they're gonna ask you select all that apply about digoxin toxicity. So mnemonic to know is BAD when, BADVEN. B for bradycardia. As we know, this medication drop the heart rate, so we will monitor for bradycardia. Bradycardia means slow heartbeat, right? A for anorexia. This medication also disturb the GI system, so patient will may not want to eat something. So anorexia is the second thing. D for diarrhea, and V for visual disturbance. Very important thing. Patient will see green, yellow, blurry vision. Patient will have green, yellow, hollow, blurry vision. Right. A for abdominal cramps, and abdominal cramps included nausea, vomiting, diarrhea. Right. Anything related to abdominal. And N for nausea, vomiting. Right. So this is very important thing, and you need to know bad man, right? That's the sign and symptoms of digoxin toxicity, right? Another important thing you need to know is when you are giving this medication, you should not give this medication with furosemide, known as Lasix, right? So why it should not given with Lasix? Because a Lasix the medication furosemide will decrease your potassium in the body, right? So if your potassium is running low in your body, it will increase the risk for digoxin toxicity. So that's why you should not combine with furosemide. As you get it. So potassium furosemide will decrease the potassium in your body, but if your potassium decrease in your body, it will increase the risk for digoxin toxicity. So that's why you should not give furosemide with digoxin. That's the reason, right? Two more very important points that you need to know for your digoxin. First point, when you are giving this medication, you have to check apical pulse for 1 full minute. 1 full minute you have to check for apical pulse, right? Where you gonna check your apical pulse? They might give you where you gonna check for apical pulse. So you're gonna check apical pulse is mid clavicular fifth intercostal space. So you're gonna check here mid clavicular fifth intercostal space. That's where you're gonna check apical pulse for 1 full minute. And second thing is, when patient develop digoxin toxicity, what is the antidote for digoxin? So the antidote for digoxin is digibind. You must know both start with digoxin and same as digibind. That's a very important thing you must know. These two things are very important. They might ask you during your exam. So you're gonna check apical pulse for 1 full minute, and digoxin antidote is digibind, right? So now let's do like 15 to 20 practice question, and you will see how easy it is going to be for you to solve all of your problem immediately, right? Just want to let you know these questions are available online for free practice, and I'm just using this question just for study purpose. This question does not belong to me. It's just for learning purpose I'm using it. Let's start first question. So we're gonna do a little bit faster because we have 15-20 practice question. First question, right? A nurse is assessing a patient received digoxin for heart failure, right? Which finding require immediate intervention? So heart rate, it's okay, right? 60, it's okay. Serum potassium level 3.0. So you must know the normal serum potassium level is 3.5 to 5.0, right? So this medication, as I mentioned, if the potassium is low, it will increase the digoxin toxicity. So your immediate answer would be answer B, right? Next question, a patient is receiving digoxin. Which of the following sign might indicate digoxin toxicity? So it will cause anorexia, right? Bad van. So diarrhea included, yes, right? Also visual disturbance. So B and C both are correct answer, but whoever created this question, maybe there are some error there. So your correct answer is B and C in this one. Patient will have visual disturbance as well as based on mnemonic Batman, diarrhea is also included. Question number 3, a nurse is preparing to administer digoxin to a patient with heart failure. Which assessment finding should cause the nurse to hold the medication and notify a provider immediately? So as we know, this medication cause the drop in heart rate, right? So if heartbeat is less than 60 in adults, that's mean you are not going to give this medication, right? Potassium level is okay here, digoxin level is also okay. So your correct answer is in this one is answer B. See how easy it is. Now we can solve all of your problem immediately, right? This medication drop in heart rate, right? So if the heart rate is already 54, you are not going to give this medication, right? Correct. Next question, a patient taking digoxin report nausea and vomiting, seeing yellow halo around lights, right? Which laboratory value is most concerning to the nurse? So we are concerned for the potassium. Is there any potassium? C. Your potassium is already there. So answer C, that would be your correct answer. If potassium is low, it will increase the digoxin toxicity. So normal potassium is 3.5 to 5.0, but here is 3.1. So right. So that would be your concerning answer. Answer C. The nurse is preparing to administer digoxin. Which assessment finding would cause the nurse to hold the prescribed medication? When you're gonna hold this medication? If the heartbeat is less than 60. So where is the answer? Apical pulse 54. See, that's what you're gonna pick up immediately, right? Easy, right? Which lab value place a which lab value place a client on digoxin at highest risk for toxicity? So again, potassium is low here. That's what is gonna cause highest risk of toxicity. So answer B. A client taking digoxin report nausea, blurred vision, and yellow hollow labs shows potassium 3.0. What is the nurse priority? So, so what are you gonna do if the potassium is low? You're gonna hold the digoxin and notify the provider. You're not gonna give administer potassium or give antiemetic check apical pulse. First thing first, what is the priority? If potassium is already low and patient is already seeing the symptoms, you're gonna hold the medication and notify the MD immediately, right? Next question, the nurse should teach the client that sign of digoxin toxicity include which of the following? What is the digoxin toxicity sign? Um, it's gonna be visual disturbance, right? Based on our mnemonic BADVAN, V for visual disturbance, such as seeing yellow and green halo lights, right? Or blurry vision. See, easy. A client taking digoxin report nausea, fatigue, and seeing yellow lights. What should the nurse suspect? The nurse suspect what? The nurse suspect digoxin toxicity immediately, right? Answer C. A nurse is assessing a client on digoxin or for heart failure. Which of the following finding indicate digoxin toxicity? It's decreased your heart rate, right? So bradycardia would be your final answer. An older adult patient is about to receive digoxin. Which assessment finding is most concerning? Heart rate is 45. That is most concerning because this medication causes low in heartbeat, right? So that would be your final answer. A nurse is preparing to administer digoxin to a client who has heart failure. Before administering this medication, which of the following actions should the nurse take? Measuring the apical. So when you give this medication, what did I mention? Two things you need to know. You have to check for apical pulse for 1 full minute, right? So that would be your final answer. A nurse is preparing to administer digoxin who had before administering this medication, check for apical pulse for 1 full minute. That would be your final answer. Digoxin is not given to a patient who has which of the following? Bradycardia. If your heart rate is already less than 60, you are not going to give this medication, right? You must know the term. Bradycardia means low heartbeat. Tachycardia means fast heartbeat, right? Anything related to tachy means fast. Brady means slow, right? Which medication should the nurse question administering to a client with heart failure? When we should not give this medication with? We should not give in with furosemide, right? As I mentioned, furosemide will decrease your potassium. So patient will urinate and by bowel movement, your potassium will lose, right? So that's why if the potassium is low in your body, it will increase the risk for digoxin toxicity. A client take digoxin and furosemide, right? Which lab value warrants holding digoxin and notify the provider? See, this is related to potassium, right? Where is potassium? Potassium 2.9. So that would be your final answer. Which drug causes visual disturbance and yellow vision? Which drug cause? Of course, digoxin. B, right? Which symptoms suggest digoxin toxicity? Visual disturbance, right? Yellow, green, hollow light, that would be digoxin toxicity. So answer B is your final answer. An infant is ordered a scheduled dose of digoxin, right? So the patient apical pulse is 78 beats per minute. The nurse would what? So as I mentioned, adult heartbeat is less than 60, you hold it. Child is less than 70 and infant is less than 90 or 100, right? So this is about infant heartbeat. Infant is less than 90, right? 78. So what are you gonna do? You're gonna hold the dose and notify the physician. So your answer would be answer D, right? So that's the wrap of our digoxin topic. See how easy it is for you to solve all of your problem immediately, right? So I hope you will have good foundation on digoxin when you see next time any question about digoxin, right? So hopefully this topic help you to understand a little bit about digoxin, right?